Hi, I am Dr. Gladys, your favorite gynecologist. You're welcome to today's Maternal Monday series, the first of its kind, where we'll be discussing everything every woman needs to know. Before we proceed on today's series, please do well to kindly subscribe to this YouTube channel and turn on your notification button. I would like to educate you on 10 early pregnancy symptoms every woman should know about. The first is fatigue. Most pregnant women do not know that fatigue is an early sign of pregnancy. Fatigue refers to some form of extreme tiredness. You wake up in the morning, you feel tired. You're done eating, you feel tired. Even after a good sleep at night, you still feel tired. So it's like all round tiredness. It's an early sign of a pregnancy. Number two is nausea. Nausea refers to that strong urge to want to throw up. You can feel nauseated when pregnant, not just early in the morning. It could happen at noon and it could happen in the evening. So the strong urge to vomit, to throw up is referred to as nausea. And most people don't know, or most pregnant women don't know that nausea is an early sign of pregnancy. Whether it comes with throwing up afterwards or not, it is known as an early sign of pregnancy. Okay? The third symptom is vomiting. So vomiting refers to emptying of your guts, food, liquid, which usually occurs early in the morning or following ingestion of any food. It could be your lunch, it could be your dinner. It's a common symptom women usually ignore when they are pregnant. They throw up a lot or they throw up every time they eat or even drink water. So vomiting in a healthy pregnancy could occur up to 2 or 3 times a day. Usually when it exceeds 3 times a day, then you need to see your doctor to have it checked out. The fourth symptom is breast fullness. Some patients will refer to it as breast tenderness, where they complain, saying, Doctor, my breast is tender or my breast is painful. It's an early sign of pregnancy as well. So waking up in the morning, feeling the breast being full, like it's pressured or it's painful, can be a sign of a healthy pregnancy and is nothing for you to worry about. That's number four. Number five, missed periods. Missed period is coming in as number five because most women feel that the first sign of pregnancy should be the absence of their menses. It doesn't usually happen that way for everybody. Some women will already start feeling the heaviness in their breast, the nausea feeling. They may have thrown up 1 or 2 times and they do have no clue that they are pregnant. So missed period is a key sign in pregnancy. So when you're expecting your period on this day and it skips 1 day, 2 days, 3 days, and there's no period, it might be a pointer that you are pregnant. That's number five. Number six, light bleeding, or what we refer to as spotting. It is expected that when you're pregnant, you shouldn't see any form of bleeding per vagina. But some women would experience some form of light bleeding or light spotting, which may be pinkish to bright red. It is also known as implantation bleed, and it could also be a sign of a healthy pregnancy. Number seven, some women will experience what is referred to as heightened smell, a situation where the smell they are used to begins to smell a bit much stronger than what they are used to. And sometimes they may begin to like a smell that they never really like, and then they begin to fall in love with a smell that they were never attracted to. Some women will like the smell of hair or just the smell of clothes, but they would not like the smell of your fragrances or you smell of your air diffuser. Some would just like the smell of a particular food, and some would like the smell of a particular soap. So whatever it is, heightened smell is one of the symptoms. Number eight, loss of appetite. Most women will experience a reduction in their intake in the early pregnancy phase. This occurs whereby the food that they love to eat they no longer want to eat it. And then the food that they do not like to eat, they would want to eat it. This can be also another pointer to an early pregnancy symptoms. You see some women, what they want to eat is roadside food, roadside fish, other than the homemade meals that they are usually used to. So a change in taste or a total reduction in appetite can be a symptom of early pregnancy. Number 9, a change in taste. Most women will find this symptom a bit difficult to describe, but commonly they would say, "Doctor, my mouth feels bitter," which is a description usually used when a woman has malaria symptoms. Or sometimes she will say, "I don't even understand how my mouth is tasting." So an abnormality in your taste buds is a pointer to an early pregnancy symptom. And finally, number 10, increased urination. Most women would have an increase in the rate at which they go to pee. We call it frequency. So they would experience an increase in their urinary frequency. This may be related to the amount of water that they take in during the day, or it may not be related to. And sometimes they may be afraid that they have an infection, but no, it doesn't always come down to an infection. They can experience in a normal pregnancy increased urinary frequency. Now, it's important to note that most of all of these changes are usually associated with the changes in your hormonal levels, leading to a rise in your pregnancy hormones as against the normal hormones that you are used to when you are not pregnant. So now you know these symptoms can basically mean early pregnancy symptoms even before that test strip comes out positive. What harm will a malaria drug do to early pregnancy, right? Okay. So I cannot say that it's harmful or it's not harmful because it can be safe in pregnancy. Yes. Yes, now. If she has all these symptoms and I do a malaria test and it's positive, I will treat her whether she's pregnant or not. Do you want the malaria to kill her? Do you get? So it's finding a balance. What the medicine will do, a risk-benefit balance. Malaria is there, pregnancy is there. Is it trying to kill her? You can overlook it. It's trying to kill her. You must treat her. What's the worst that will happen? She'll lose the pregnancy. She'll get pregnant again. You do not sacrifice the egg. You sacrifice the egg, you do not sacrifice the chicken. Because the chicken will get pregnant again. You have another egg. So I don't want to discredit because somebody might say and say that she saw a video that you should not take malaria this thing. Now lie you. It's not one size that fits all. Some women you will have to treat them. Some you can just overlook it and nothing will happen. Yes. So it's an individual care. That's why the ones that come with malaria symptoms like that bitter mouth, like that loss of appetite, like that urinary frequency that they'll be thinking is UTI, I try to highlight it that this is what may be running through your mind. So in conclusion, I hope you've enjoyed today's series on the 10 early pregnancy symptoms. Do you have questions? Do you need clarifications? Please drop them in the comment section. I'll be looking forward to seeing you in our next series. Bye.